Everyone right to go? Thanks very much for joining us here. At the outset, can I say that National Cabinet's meeting at 2 o'clock and there's a number of items that have just become known to us, so I've got to head off here. I've got about 45 minutes. I don't normally like to limit these things, but I've got a number of papers I've got to be briefed on before we head off to that National Cabinet meeting. Off the top, though, there are 209 cases today, 208 locally acquired and one a returned traveller in hotel quarantine. Sadly, a man in his 60s has passed away. I don't have any further details, but the show release later today can provide, subject to the confidentiality, obviously, of that family, any further information about that individual. We, of course, send our deepest sympathies and our best wishes to the family of that man in his 60s who has passed away. 96 of today's cases are linked to known outbreaks and cases, with 112 that are under investigation by our coronavirus detectives. That number is going to continue to grow because interviews, obviously if you've got to do more interviews, it just means the workload is greater, and I think there's also a bit of a trend in recent times, more complex interviews that are taking longer for us to do, whether it be issues of language, culture, all sorts of different issues that become, just make that task a little bit harder. But Jerome might be able to speak to that in more detail when he goes through that outbreak map, as he always does. The total active cases with those I've announced today is now 1,180, 1,176 locally acquired and 4 which are overseas acquired. Yesterday, or that is to say overnight, we received 48,572 test results. That's a fantastic effort. Again, we thank all of those people who've gone and got tested, and we thank particularly those who, prompted by symptoms, have wasted no time at all and gone and got tested really fast. That is incredibly important. Of that 48,500 tests, around 6,000 of those are Shepparton tests, day 13 tests, and that's a significant thing to have got through a big chunk of those day 13 tests, given the sheer numbers of people who have been isolated away as close contacts as part of the Shepparton outbreak. I thank those people for coming forward. I thank them for the contribution they've made to keeping all of us safe by being locked in 24/7 in their homes. We thank them very, very much, and the response of the people of the Golden Valley, yet again, just quite an amazing effort, and we're deeply grateful and so impressed and so proud of all that you have achieved. There will still be some people who at day 13 test positive and will have to be in for another 14 days. There'll be others who become close contacts that'll have to make that sort of sacrifice as we look to the weeks and the months ahead, and in anticipation in that community and in all communities. We thank people for the work that they do. It is such an important part of our response to this virus. In terms of vaccines, there were 33,511 vaccines administered in our clinics yesterday. That's 2.517 million doses that have been administered in total through state-run centres, with more than 5 million doses across the state from all sources. That's very impressive. This is really ramping up, and that's such an important part of how we chase down that 80% double dose target. That is central to the delivery of the national plan. We're now more than halfway, well and truly more than halfway, toward Victoria's target of 1 million doses over a 5-week period. I can report that we're now at 589,282 doses. So we will, I think, not only meet the 1 million in 5 weeks, we're on track to, in fact, beat that target and get there a little bit earlier than we had planned. That's fantastic news. There's a lot written and a lot said about vaccine hesitancy. That's not the experience that we've had to this point. People want to come forward and get their vaccine. Indeed, in some respects, more than we have vaccines available. However, that is easily remedied, and I'll come to that in just a moment. We are still obviously a number of days away from being at that milestone we talked about the other day of 70% single dose. We're still a number of days away from that, but every vaccine that's administered today and every person who makes an appointment with a sense of urgency brings the day that we get to 70% first dose, it brings it closer. So the more people we vaccinate faster, the quicker we'll get to 70% first dose, and the quicker we'll be able to make those, that is to say, deliver on those announcements we made the other day. So the quicker we get to 70%, the more vaccinations there are undertaken, then we'll be able to make those changes that we announced the other day, perhaps earlier, And of course, there's other work going on to try and add to that list, noting that it was a modest list, because that's what was considered safe by the Chief Health Officer. But there may be some other things I've mentioned, outdoor recreational activity, things of that nature. Potentially some other industry settings. Again, it will need to be modest because of the situation we're in, but we will have more options once we reach that 70% first dose. The more people who get vaccinated, the quicker we'll get to that marker. That is the point that I'm making. In terms of AstraZeneca and any sense that, look, you can wait, you can get vaccinated in 6 or 8 weeks or in a couple of months' time, whatever it might be, the best vaccine is the one that's available today. AstraZeneca is available today. We spoke earlier in the week about the fact that there were 72,000 appointments that were unfilled. I'm pleased to say that number is now down to around 50,000. In fact, just on one day, no doubt linked to the fact that we had bought the, on expert advice, the AstraZeneca interval from 12 weeks to 6 weeks for the second dose, we had 14,170 AstraZeneca bookings made on a single day. That is very significant. I just wanted to give you an age breakdown of those bookings. 18 to 29, 5,707. 30 to 39, 5,082. 40 to 49, smaller numbers, only 298. About 500 in the 50 to 59 age bracket. Just under 2,000 in 60 to 69. And some 620 bookings in 70 plus. Put it another way, on that single day, one of our biggest ever single days of bookings for AstraZeneca, 3 in 4 of those bookings was for someone under 40. This is a choice that's being made by hundreds and hundreds of thousands of Victorians. We've already got 2.6 million AstraZeneca doses into arms, our clinics and others. And what that means is that literally millions of Victorians will be double dose vaccinated with AstraZeneca. It's safe, it works, it is available right now, and that means for many, subject to a conversation with a doctor or a pharmacist or a senior nurse vaccinator who we will provide to you at a state clinic, it is the best vaccine. It is the best vaccine for you. In terms of one further point on AstraZeneca, I would note that the Prime Minister, I think yesterday, wrote to all over 60s across the country and made the point that the next cohorts of people that will become eligible, next groups of people that will become eligible for Pfizer will be younger kids in that 12 to 15 age group that are currently, they're approved but they're not yet eligible. People over 60 who are already eligible for a vaccine, the AstraZeneca vaccine, the Prime Minister's made clear that they will go into the queue behind those who are eligible and can only receive Pfizer. So I suppose the message I'm sending today is talk to your GP or make a booking at a state clinic and come and talk to a health professional when your booking comes up. Turn up and have that important discussion. That's available right now. Don't get in the queue if you're over 60. Don't get in a queue that's right down to 12-year-olds. That's going to be a very long wait, and we don't have time to wait. We need to get as many doses into as many arms as possible. Victorians have done an amazing job in terms of AstraZeneca take-up. Every time I speak to the Prime Minister, he notes just how much success we've had with AstraZeneca, and he also makes those comments publicly. Don't get in a queue with millions of other people. Go and get vaccinated, book an appointment today, and as I stand here, there's 50,000 appointments available over the next 3 weeks. Go online, book one of those appointments, and then, of course, when you turn up, have that conversation, make an informed choice, and hopefully get the vaccine that is available right now. That is such an important part of our campaign and our struggle, all of us, against this virus in this global pandemic. Now, I don't so much have announcements to make today, but I did want to highlight some work that's going on at the moment very quickly. First of all, we are expanding and we will train up a bigger and broader health workforce to administer vaccines. It's essentially everybody who can do this safely needs to be part of that team as we grow and expand the total amount of vaccinations that we do. With expanded hours, with many more appointments being offered over time. Again, a lot of this is subject to supply, and just as I was coming into this meeting, it seems that the Prime Minister will have some very important news quite soon, it seems, in relation to additional vaccine supplies. I'll let him make those announcements, but if what's reported pans out, that's fantastic news for all of us. So we are going to move to including dentists, oral health therapists, pharmacists, podiatrists, that's hospital pharmacists, podiatrists, nursing and midwifery workforce, paramedical students. The student involvement is really important. Those who are partway through their studies but are not yet fully qualified, they have and can be trained up to have the requisite skills to be part of this workforce. We don't want a situation where the number of people to administer the shot is a limiting factor. We don't think it will be. So these are just logical, common sense changes, and I think they will serve us very well. In terms of final year school student blitz, so that year 12 vaccination blitz that we announced earlier on in the week, that priority program begins from next Tuesday, the 7th of September, and runs until the 17th of September, that Friday. This is all about making sure our senior students who are sitting those year 12 exams have certainty and have at least one dose as they head into that exam period. There'll also be a number of teaching staff and examiners and people who supervise that activity who will need to be vaccinated and will be part of that process. Schools will reach out to year 12 students and indeed year 11 sitting year 12 exams, so doing year 12 subjects. The best way to do this is not so much from the centre, but to have that local specialised, that important communication at a local level, and that's how this will work. Schools will reach out to their senior students and have that discussion about making bookings and about getting through as part of that blitz. They will have priority access to appointments, and they will have priority treatment when they turn up at a state clinic. Those bookings, those appointments, will be able to be made from Monday the 6th of September. We think it'll be around 50,000 priority appointments that we will need to have booked and then processed, and we're very confident that we'll be able to do that. It's not just at the 55 current state clinics across the state. There'll also be a number of hubs that will pop up, as it were. Just to give you a couple of examples, Gladstone Park Secondary College and Roxburgh College in Hume, Point Cook, Tarneet and Werribee Secondary Colleges in Wyndham, Lakeview Senior College in Melton, and Dandenong High School in the greater Dandenong area. This is about bolstering our current vaccination network and making sure that we've got extra points, as the Commonwealth call them, points of presence, where people can go and get their vaccination as a priority group. They are kind of by way of their sort of things to announce today or things to confirm. I just also wanted to run very quickly through some of the other work, and it's only a few examples among so many other pieces of work that are being done at the moment, so that as soon as possible we can lay out a very detailed, a comprehensive roadmap in our race to 80%. What does that look like? What are the steps along the way? Perhaps the best place to start is just to talk a little bit about the fact that the Burnet Institute done a lot of work for us over the journey. They're currently refreshing and recasting all of their work for us around how many cases we can expect to see and the types of cases, where they'll be, all of that outbreak modelling that is being done at the moment. It'll also, not just about cases, it's about hospitalisations, health system capacity, so that we can, to the best of our ability, chart two lines. One is a line of growing cases, and the other is a line of hospital system capacity. And we have to make sure that those lines don't cross over, and that in fact we're not seeing over time a situation where there are more cases than there are beds and health staff, more cases and that overwhelm the amount of hospital capacity that we have. That is not just a function of ventilator machines or beds. As I've said to all of you many times, healthcare is not delivered by machines, it is delivered by people. So our workforce is critical in making judgments about exactly how many people we can treat, not just COVID patients, but all of those other patients across Victoria who need care, and they need care of the highest possible standard. So all of that work is currently being done by Burnet, and we will have more to say about that when that work is finished. Earlier in the week I indicated that we would in good time, noting that we did have some time, to finalise an enormous amount of work that's going on in relation to what Term 4 looks like for our schools. I wish I could stand here now and provide a definitive set of dates and a timeline and all sorts of answers to all sorts of important questions. The fact of the matter is that there is work that has to be done. It's been underway for weeks and it's getting close, but there's still some finishing touches and some more work that has to be done around that. We will have a detailed sense and that roadmap, that part of the roadmap in our race to 80%, we will have more to say about that soon. But to give you a sense of some of the work that's going on at the moment, we know, both common sense tells you and also international experience, that the way in which you ventilate schools, the way in which airflow works in school spaces is incredibly important in terms of containing and hopefully limiting the number of infections in any school-based environment. So ventilation assessments using literally thousands and thousands of CO2 monitors, because as you can appreciate there are many rooms right across our school system, that is going to be underway very soon, so that we can test which rooms have sufficient airflow and which don't. There will then be the use of HEPA filters, air filters, in a number of those rooms that don't have sufficiently high airflow. This is all about making sure that we, in a very practical sense, limit the spread of this virus and keep our kids safe. There will, I think, be more and more outdoor learning spaces. All of that work is underway. I'm not here today to make announcements about that, but just to give people, particularly parents, absolute clarity that an enormous amount of work is going on at the moment, so that we can be ready soon to announce detailed plans and a detailed roadmap in relation to what term 4 looks like and what we believe will be safe. That'll happen as soon as it possibly can. The other thing too is I want to join with the Premier of New South Wales, who I think has made some comments today, that as soon as the TGA approve that RAT testing, rapid antigen testing, for use in a broader range of settings, and particularly rapid antigen testing, which cannot be administered by yourself. You can't self-administer that. It has to be administered by a nurse, which obviously I wouldn't want to be taking nurses away from a vaccination clinic to be running rapid antigen testing so that we could have a sporting event, for instance, at the moment. You know, we need broader approvals. We need approvals from the TGA to use that testing in lots of different settings. And I agree with Gladys when she says that those approvals can't come fast enough. There may well be applicable, logical, that we use some of that rapid antigen testing self-administered as part of our return to the classroom. I wanted to speak a little bit about the vaccinated economy. I had a very lengthy and a very good discussion with the Prime Minister on Wednesday evening about a number of different things. And one of the things that we obviously agree on, and I stressed with him, was the notion that at 70 and more likely at 80% double dose, we will have opportunities to open up parts of the Victorian economy to those who have been vaccinated. Put it another way, when we get to those vaccination double dose thresholds as part of the national plan, the notion of a lockdown of the whole community is far less relevant. But what will, I think, become a bigger part of our response is a lock-out of many, many venues for those who are not vaccinated. Now, that might seem a bit harsh, but I've said this before and I'll make the point again, that I'm not going to lock the whole state down to protect people who won't protect themselves. Yes, there are some supply issues with vaccine at the moment, but that by the time we get to 70 and 80%, everybody who wants to be vaccinated, I think, will have been given an opportunity to do so. So I think if you're not vaccinated, and you could be, then the chances of you booking a ticket at a sporting event, going to a pub, going to all manner of different places will be very, very limited. Now, in order to have that system up and running, we're already well and truly underway in terms of discussions with a number of industries to run some predominantly outdoor vaccinated economy pilots, if you like. Proof of concept, to make sure that the technology works, to make sure that our systems and processes work. They'll be small scale, but they'll happen very soon, and the discussions are well and truly advanced in terms of making that happen. Similarly, home quarantine, I agreed with the Prime Minister on Wednesday, and we'd already been doing quite a bit of work on this front, but I agreed with the Prime Minister on Wednesday, as I think New South Wales have agreed also, to run a home-based quarantine pilot here in Victoria. Now, I think technology will be an important part of it. and there's a lot of work been going on for literally months around which technology is best. There's also been, on behalf of National Cabinet, a pilot in Adelaide, and I thank the South Australian Government for the work that they've been doing. We'll soon receive the results of that work and the report on that work. We've been doing some of our own work as well. Now, I'm not announcing this today, but just by way of example, and I think it's only fair because as I've said to you so many times, if we're doing the work, it's fair that you know about it. I think one of the ways in which we will get those Victorians who are stranded in New South Wales, particularly those who are in the border bubble already, one of the ways we'll get them home is potentially home-based quarantine with the use of technology coupled with testing. We'll have more to say about that as soon as we possibly can. I know that group of people will be watching and listening, and they want to come home, and I want to get you home. We just have to do that safely. So I suppose the reason I provide you with these 3 or 4 updates today is just so that everybody across the community has got absolute clarity that there is a power of work going on. That's just 3 or 4 streams of work. There are dozens of different areas where people are working as hard as they possibly can to make sure that not only have we got a comprehensive roadmap, detailed plans and policies, not of talk, but action, things that actually work, things that will make a difference. That work is ongoing, and it's why people are literally day and night working to get all this done. When it's ready, when all of these elements are ready, then we will make announcements in part and then in full about that roadmap in our race as Victoria to 80% double dose. That's what we have to get to. There will be some milestones along the way, but again, perhaps the most important message today, apart from getting tested if you've got symptoms, go online right now, take one of those 50,000 AstraZeneca appointments. Don't wait for whatever announcements are made next week. Don't wait for the next lot of Singaporean or Polish vaccine to turn up, or some deal that might be done with the UK. That'll all be good, but that's uncertain. What is certain is that there's 50,000 appointments and your name can go beside one of them today. And then 6 weeks later you can get your second dose and you can be fully protected. There's no one in hospital at the moment on a ventilator who's been double dose vaccinated in our state. And I dare say there's no one even in New South Wales, as challenging as the circumstances are there. This is incredibly effective, like 90% effective against serious illness. Do it for yourself, do it for the people that you love and the people who love you, and do it for people you'll never meet, people across the community. It's such an important thing. Don't wait for what might happen. Make it happen for you and your family today by taking one of those 50,000 appointments. At all of our clinics, there will be a doctor, a pharmacist or a senior nurse vaccinator who can take you through what AstraZeneca means so that you can make an informed choice. I'm so pleased and proud that more than 2.6 million AstraZeneca doses have been administered in our state in these last few months. I don't think any state has pushed as hard. The key point here is we can do more. We have more stock. We have those appointments available. Please take one of them. Please put your name beside one of those appointments right now, like millions of other Victorians have. I'll now ask Jerome just to go to the kind of epi of the day and, as he always does, a bit of an outbreak map, and then we're happy to take any and all questions. I do apologise that there was a bit to cover there, I know, and if we can kind of be out of here at that sort of 2:30 at the latest would be very good. I say that with a sense of hope. Who knows whether you'll help me deliver on that. Jerome.
Thank you, Premier. I'll do my best to be brief. Good morning, everybody. 209 positive cases yesterday in Victoria, diagnosed yesterday, and of course, sadly, 1 death. And I'd like to add my condolences to the family of the man in his 60s from Altona North, who sadly passed away yesterday. 64 other Victorians in hospital, 16 of those are in intensive care, and 11 of those are on ventilators. And 20 of those Victorians who are in hospital are under the age of 40. We continue to see far too many young people in hospital with coronavirus as we continue to struggle with this outbreak. In terms of the 208 local cases, 1 case was in hotel quarantine. We have 2 cases in Shepparton out of the day 13 testing. 48 cases out of our western suburbs, which includes in Altona 9 cases, in Tarneit 4 cases, and in Truganina 3 cases. There's a bigger cluster of cases in the north, in our northern suburbs, 128 cases in the north, of which in Craigieburn there are 14. In Dallas there are 12. In Roxburgh Park there are 8. In Broadmeadows there are 12. And in Glenroy there are 9. We have 13 cases in clusters in the east, including 3 new cases in Richmond and 2 new cases in Prahran. And then there are 17 other cases in other LGAs. What we're also now seeing, of course, we continue to use wastewater very carefully to see whether there are other potential, and I stress potential, emerging cases of concern or areas of concern. And we are seeing wastewater detects in Essendon and Tottenham, in the southeast, in Cranbourne and Hampton Park, down in the south in Chelsea and Carham Downs, that wider Sandbelt area, and out towards Glen Waverley and Wheelers Hill. And the purpose for reading out these suburbs is what we've seen in the last day or two is new parts of the map that are lighting up, and we're finding new communities and new people who are coming forward for testing. We've had many very powerful conversations with diverse communities over recent days and weeks. Many community forums, many evening meetings to discuss and to understand and listen to people's concerns. As a result of that work, we are seeing many tens, many hundreds of people from different parts of Melbourne now coming forward for testing for the very first time. And I just want to thank everybody. If you've made the decision to come forward to get tested for the first time in the last few days, if you've been wondering about it, we're so grateful that you're part of those 48,500 people coming forward for testing. And as a result of that, we are finding whole households with multiple people who are ill with coronavirus. Not one, not two, but the entire household that's infected. We're finding cases where when we first find people with coronavirus, they're going straight into hospital. And we are finding isolated cases, but cases of people coming into our emergency departments and being diagnosed with COVID in the ward. So I stress again, it's really important now that if you've got any reason to be concerned about coming forward for tested, if you're worried about the consequences of what getting tested means, about losing work, if you're concerned about if you go and become positive that you'll get locked up or bad things will happen to you, the only reason we want you to get tested is so we can provide you and your family with the medical care and support that you need to stay safe. The quicker we can get to you, the more support that we can provide, and the more we can prevent the virus from going through to those who you love and to other people that are in your household and in your wider family network. So please, and if you're just not sure, just come forward to go and get tested, as so many people did yesterday, and it's helping us to find out where we have cases of community transmission. It helps us to support those groups and those communities in the best possible way. And my thanks to everybody who is doing exactly that. We have seen over recent days, again, a number of workplaces that give us concern about COVID safe plans and how effective they're being used. If I look at a construction site that we're working on now at Box Hill, we have found 20 cases on that site. That's not an isolated case. Similarly, we have a distribution centre out in the west where we found 4 cases. Distribution centres that are critical to putting the food and services on our shelves every day, or foods, for good and foods on our shelves every day. And including the call centre in St Kilda, again, 17 cases now positive in that call centre. And to those employers, we have essential workplaces that are open for that very reason, because they're providing essential goods and services that keep all of us going whilst we're in lockdown. But please, if you're an employer, check your COVID safe plans and make sure you're doing everything you need to keep your workforce safe and to keep your business safe. Because we're now at a level of community transmission where you just can't trust that people coming in are okay. There may be members of your staff who are COVID positive. We need to, of course, ensure that they come forward and get tested, but we need to minimise the risk of infection at the remaining workplaces that are open. So my thanks to all those employers. I know you're doing it tough at the moment. I know it's hard to maintain those critical services, but please look after your staff and do everything you can. And please, if you need more support from ourselves or our colleagues in the jobs department, we're there to provide that guidance and support so you can operate as safely as we possibly can at this time. In terms of Shepparton, as the Premier said, 6,271 day 13 tests done yesterday. Again, phenomenal response from the community in Shep yesterday, and that wraparound response continues and will continue for the days ahead. My thanks to our partners in local councils, local community organisations and various relief organisations for their amazing work out there. And it will become a bit of a template as to how we continue to support communities where we see significant levels of community transmission going around. We'll have those day 13 tests over the next day or so. Obviously some work for us to do over the coming days to complete that process, but I'm hoping to see significant reduction in primary close contacts in Shepparton over the next day or two. In terms of the active areas of focus at the moment, obviously we continue to be now very focused on the north. We're seeing a slow transmission or a slow progression of the virus from some of our western suburbs into our northern suburbs. 48% of all active cases are now in our northern suburbs. 42% of all of our active cases are in our inner western suburbs. And we, of course, continue to work closely with a range of local organisations and community groups to provide that local support to people to ensure that they can isolate safely and come forward with confidence to get tested and to play their part in stopping this community transmission as quickly as we possibly can, so that we have options for the weeks and months ahead. Finally, in terms of the border arrangements, we made a series of changes made last night by the Chief Health Officer around the border bubble arrangements between Victoria and New South Wales. And of course we continue, as we have been over now a couple of months, to be concerned about the risk of further incursion, and as we work so hard to get on top of these current cases of community transmission, we need to minimise the risk, particularly to regional Victoria, of more cases coming in. As a result, we have reduced the number of local government areas in the Victorian side who are part of that border bubble, which allows easier access across the border. So the following LGA areas have been taken out, which includes the city of Greater Bendigo, the city of Greater Shepparton, Benalla, Bloke, Loddon and Yarriambiack. Those council areas are now removed from the border bubble area. The remaining council areas will, of course, continue to operate as per normal. Similarly, on the New South Wales side of the border, the LGAs of Broken Hill and Edward River have also been removed from the border bubble arrangements. Later on tonight, we will also reduce the categories of authorised workers that are able to get permits that can cross the border. We will also put more testing obligations on those critical, necessary, essential workers that do cross the border to ensure that they are tested not only within 72 hours of crossing into Victoria, but also again at around day 6 or 7, and again at around day 13 or day 14. Those details will be out in the Cho release this afternoon. And my thanks to those critical workers who continue to do the hard yards of working across both sides of our borders to keep those essential routes open, to keep that essential freight moving, and of course to the border communities as we continue to work to keep any further cases of community transmission out of regional Victoria. Finally, on vaccination, again, we continue to see fantastic numbers of people coming forward for vaccination. I'm delighted to see that 2/3 of those Victorians over 70 have now been double dose vaccinated, and that over half of Victorians between 40 and 70 have also been, over half of those have been double dose vaccinated. So we're starting to see those increases coming through and seeing rapid rises in the vaccination rates amongst younger Victorians. As the Premier has said, there are many AstraZeneca appointments available. Please make sure you book in so we can all be protected from the ongoing community transmission that we're seeing. I'll hand back to the Premier for questions.
Thanks very much, Jerome. I'm happy to take any questions you have.
I know you're waiting on modelling that you mentioned earlier, but can you give us any indication of how bad this is going to get? I think that 200 number has caused some worry today.
Yeah, look, we've seen in recent days, we've gone from 50 to 100, 100 to 200. We have to do everything we can as a community to stop that doubling. And that means that no one out there in the community should read into the fact that we've been frank and honest and said, look, we're not going to drive this down to zero. That doesn't mean the rules don't matter anymore. That doesn't mean that somehow there's less pressure and less tension there. In some respects, we all have to try even harder, and I know that Victorians are giving so much. I know that, I understand that, and I'm deeply grateful and proud of that. But this is not a time to make a judgment that the rules are for someone else and that you can go and visit, all those sorts of things that we've seen. We're going to see cases rise. The maths of this is undeniable, but we've got to slow the rate of increase. We've got to make sure that we're doing everything we can to see them, yes, go up, but go up as modestly, as slowly as possible. Otherwise, they will rise, the number of cases will rise faster than we can get jabs into people's arms and get the protection of being partially and then fully vaccinated. And the number of cases will overwhelm our health system. And when I look to what's occurring in New South Wales at the moment, I know enough about the health system, and I know enough people who work in the health system here and some in Sydney. And it's, they've got a lot of patients. They're over 1,000 patients, if not now, very soon. They're up to the 150 plus in intensive care. Intensive care units are pretty full on the worst non-COVID day. They're under a lot of pressure. On any non-COVID day, they're under a lot of pressure. They do intense work. We've just all of us got to find a way to do everything we can to limit the spread of this. And the way to do it is get tested as soon as you feel sick, get vaccinated because there are appointments available for you right now, and follow the rules.
But is the data that you've got in front of you, or maybe from Jerome with the wastewater testing, telling you that people that normally stick to the rules have somewhat given?
No, I wouldn't say that. I wouldn't say that we've seen slippage, but just in the last couple of days coming into work to do things that I have to do at work, there's a bit more traffic on the road, it seems to me. We've all just got to understand that if we don't keep following these rules, we are going to see these cases skyrocket, and that is really challenging for our health system. Just think about our nurses and our doctors, our AMBOs, the whole team in our hospitals. None of us should do anything to make their job even harder. The best thing to do, follow the rules, get tested as soon as you feel sick, and get vaccinated. And there are appointments available right now.
From New South Wales are emerging about the Pfizer swap with the UK, and the initial numbers are that New South Wales are getting about 1.2 million and we're getting 1 million. When you talk about equity between the states, does that sound right to you?
That'd be about a pro rata allocation. But I'm not doubting the faithful and accurate way in which you're reporting it, but I'm probably at somewhat of a disadvantage given that those announcements are being made concurrently with me trying to answer your questions. Again, I would just say to people, yes, perhaps there is some extra Pfizer coming, and that's fantastic, but it hasn't landed yet, and an appointment that you can put your name beside right now is better than some promise off in a week or two or a month. Book now with confidence. Do what you can. These are uncertain times. What is absolutely certain is that there's 50,000 appointments sitting waiting for your name. Put your name beside one of them and then turn up.
Premier, doctors are telling us that they're struggling to get people to take AstraZeneca. What are you doing to convince people to take AstraZeneca beyond just standing here and asking people to?
Well, Clay, 2.6 million jabs would indicate to you that 2.6 million, well, it's not quite that. It's almost a million that are fully double dose vaccinated. So these are decisions. Sorry,
they're fairly modest numbers you just read up before. I mean, would you consider?
No, they're not modest at all.
Financial incentives?
No, hang on, they're not. They're not modest numbers. They're in fact numbers that lead the nation. That's why the Prime Minister keeps giving us a shout out about this. The point I'm making is, it's not like I'm asking you to do something as Victorians. It's not like I'm asking you to do something that no one else is doing. Hundreds and hundreds of thousands, in fact around 1 million Victorians are double dose AstraZeneca covered.
Would you consider incentives of any form?
At this stage, the greatest incentive is freedom. If you're vaccinated, you are going to be able to participate in the economy. You're going to be able to go to a pub, the cinema, to a sporting event. You're going to be able to do all sorts of things that an unvaccinated person is not going to be able to do. Far from being locked into your house, you will have freedoms that others won't have. They will be locked out of a whole range of venues because they could be vaccinated and they've chosen not to. That's the greatest incentive, is to get these rules off and to get our freedoms. But also, can I say, it's not just about those sort of very personal things. It's also the greatest incentive is to make sure that our ICU nurses and doctors and all of those heroes in our health system have just a little bit easier task.
Premier, in other jurisdictions, they've used an incentive for those that have been double vaxxed to get a passport to be able to go to venues. Sweden, Denmark, Greece.
Yes.
After a certain point, maybe not 35. 50%.
No, certainly not 35. Look, what we're
60%.
Yeah, what I said just a bit earlier on is we're going to do very soon some pilots and trials just to get the tech right and make sure it's all as it should be. That'll be principally outdoor, but I can see a situation where as we get close to that 70% mark, double dosed, we will have a situation where the economy is operating for the vaccinated. Not everywhere, not at full capacity, but the notion of, for instance, some outdoor drinking and dining, things like that, will be absolutely possible. And the preference will be, in fact, it may well be only open for those who are double dose vaccinated. So there's every reason to get vaccinated for yourself and for everybody else.
On the economy, one of our clients just told me that he's losing $10,000 a week on coffees alone and the distributor of coffees is losing $150,000 a day. Now that's fairly serious.
Absolutely, it is.
Yeah, I mean, I'm not suggesting it's your fault. I'm just suggesting that we talk about the economy, but we tend to talk from a perspective like it's out there.
Yeah.
It's actually affecting people on a daily basis. In a very
No,
serious
absolutely
way.
it is. That's exactly right. And I think we've learned all the way along that providing business support is very important. I'm not here today to make those announcements, but I think you'll see as early as tomorrow, the Minister for Industry Support will be out talking about a further partnership with the Commonwealth Government to try and provide the very businesses you talk about with some additional support. There's no economic recovery until we get the health system under control. That's what we've learnt. It's painful. I wish it was a different way. I wish we could have the economy operating alongside this virus, that we could all be out, at our favourite restaurant, buying coffees, back in the office, doing all sorts of things. That is simply not possible. Our health system will be absolutely smashed to smithereens if we try and do that.
Premier,
And we just can't.
Can we please get some more information on the expansion of the vaccine workforce? What would that look like in practice? How soon will those people that you mentioned be trained up? What are the nuts and bolts of that?
Yeah, there's obviously a whole lot of different workers who can perform those tasks. Students as well, who've got well and truly enough, skills to be able to do it. They just might need a little bit of additional training. It's a relatively simple exercise. I do want to stress, though, that these sorts of people are not the people, students, for instance, who would you be sitting down and having a consultation with about whether you should take a vaccine. That will be occurring with more senior people. But Jerome, did you want to add anything to that?
Yes, look, over the last 6-8 months, we've been running the vaccination program through our state clinics here in Victoria. We've used a range of staff already to ensure we can provide safe and effective vaccinations. We're now, with the active support of our health services and with the right health service unions, we're broadening out the pool of staff who are already medically trained, clinically aware, and giving them the additional skills so they can provide safe and effective vaccinations. There will continue to be experienced nurse vaccinators who will of course manage closely teams of new vaccinators that will come on board over the weeks and months ahead. But this is about actually scaling up for the program that we've seen come along. With the Commonwealth timeline of vaccine delivery, that is giving us the visibility to step up the vaccination levels we're doing at the moment. Right now we're doing 230,000 or so vaccinations a week in our state clinics. We will then, with more supply coming available, we will step that up as much as necessary, using these additional workforces to sustain that, so we can get people vaccinated as quickly and as safely as possible.
Premier, for all if I can just ask the Premier, can I just one for you? Oh, go. Sorry. Can I just ask you one about Box Hill? Or you?
Sure.
I don't know. I don't run the press conference. You do.
I'll be here for a bit longer.
Premier, if we're talking about
Some of you may be disappointed to hear that, but anyway, that's fine. Yes, who's next?
If we're talking
Yep.
about events for the only vaccinated, are we also looking at stepping up the mandatory potential in our healthcare system? Particularly, we're hearing today there's some hesitation among paramedics.
Yeah, I just want to be, look, I'm glad you asked. We will have an economy that operates much more freely and openly for the vaccinated. We're doing trials at the moment to be ready for that. I've agreed with the Prime Minister and I've made that very clear to him. That's what I want to do, and that's what we are doing. We'll have more to say, because that's not a simple thing. That takes quite a lot of planning and work, and that's been going on for quite some time, but we'll have more definitive announcements to make about that. I'm just trying to give people a sense of some of the stuff that's going on in the background at the moment, like and as I said before, a power of work. In terms of compulsory vaccination, it may be that we have to make compulsory, mandatory, in a number of areas. I wouldn't want anyone, though. There's a bit of a tiff today between the doctors' union and the paramedics' union. I wouldn't read into that there's any hesitancy amongst AMBOs at all. They'll be getting vaccinated just as quickly as they can. Some people do have mild issues the day after they get vaccinated. They might be a bit under the weather. These are things that have to be balanced, and I'm very pleased. And all the briefing I get in nurses, medical staff, ambulance paramedics, allied health professionals, all the way through, run through to prison officers. Everybody in those kind of priority cohorts, where if they're not vaccinated, there's a greater risk. We've done very well so far. We're well and truly on track. The mandating is just about perhaps that last push, to get everyone there. And often people work to a deadline, but I know our paramedics are doing an amazing job, and I wouldn't read anything into that. I don't think there's any hesitancy whatsoever And in fact, if it is down to just sort of 4.5% that haven't been vaccinated, that's probably higher than just about any other cohort anywhere across the country. So we'll finish that off in all those different areas, and mandatory vaccination may well be a part of that.
On mandatory vaccination,
Just like aged care, I should add.
the AFL have said that they won't make vaccination mandatory for AFL players. Should they be pushing that more, given that if you want to buy a ticket to the footy in the future, you might have to
I'm not
vaccinate?
certain what the percentage of AFL players who've already been vaccinated is now, and I don't know what it will be once the rest of the community is at 80%. But I would say to anybody who plays elite sport, whether it's AFL players or anybody else, you are people that are looked up to, you are people that are role models in the community, and you should be getting vaccinated unless you've got a medical reason not to. That's the responsible thing to do. And yes, Charnel, it's a very good point that you could be on the field and not be vaccinated, but you can't be sitting in the grandstands watching. That doesn't make any sense to me. But I'll let the AFL deal with their own players, their own workforce, as it were. But why wouldn't you? If you're someone who's going to be travelling all around the country, meeting and being with so many people to keep yourself safe and your family, and make a contribution to keeping the rest of us safe, surely you would want to be vaccinated.
You just mentioned trials in terms of what's going on with the background work. Is that specifically a trial for how a lockout would work?
Yes, so we will do some industry pilots quite soon, where we will have it, and it may well be that some positive news for regional Victoria next week, which is what we're all working towards, may well mean that we can do some of those trials as part of that opening up. What we think is very important, not that it will only be open to vaccinated people, we're too low for that, but we can do some of those pilots safely in regional Victoria potentially, hopefully, because they will be not locked down anymore. Today's not the day for their announcements, but that's what we're working really hard to get to. This is just about trying to make sure that we've got all the practical things ready so that we can, when we get to that 70% and 80%, when we get to those higher numbers of double dose, we can have the places open as possible, functioning, trading, people making profits, people securing jobs, doing all of that work as much as we can, as safely as we can, and hopefully it's also a reminder to people that there's every good reason to get vaccinated, all the health reasons, plus if you want to go and do the things you love, get yourself double dosed, and there's 50,000 AstraZeneca appointments available today.
Where you talk about our health system getting smashed to smithereens if we were to open up or go any further than where we are right now, can you give us a sense of the numbers you're looking at that is essentially making you feel that way? Because there was a suggestion from Canberra today from Professor Brendan Murphy that our hospital system can handle a COVID surge that's obviously coming.
Yeah, but a COVID surge that's unavoidable is very different to let's just open everything up now. That's a COVID surge that occurs because we've managed the two peaks properly. So we have peak vaccination and peak cases. If peak caseload comes before we've got everyone that's going to get vaccinated, then we finish up with literally thousands and thousands of patients. A goodly number of those are in ICU, and again, machines, yes, you need ventilators, and we've got adequate supplies of all that, but the ventilator doesn't run itself. You need a highly trained, highly skilled nurse, and need a team of people to provide care to each and every one of those patients. And that's just the COVID patients. Our hospitals, they've got a lot of patients, thousands of patients to treat every day that don't relate to COVID. So we have to balance those things together. If we opened up today, we wouldn't be reporting a couple of hundred cases. We'd be very soon reporting thousands and thousands and thousands of cases per day, and 10% of those will finish up in hospital. I wish it was another way. I think if you look at what's happening in Sydney, that just puts beyond any doubt. These are not academic points. They're not arguments. They're just facts. If you have cases get away from you, then you will finish up with people in hospital, and it does put a lot of pressure on.
On our current settings then, what are you looking at if we stay exactly as we are, and we're obviously waiting for the 70% first dose?
Yes.
What are the numbers that we are going towards? Because we've seen huge jumps in the last 3 days. And can you just give some detail around each person? How many others are they infecting based on the numbers we've got right now?
We've certainly... let me come back to you. Perhaps over the course of the weekend we can give you a bit, because you need a bit of time to calculate a ref rate, that is each case, how many people they're giving it to, and time is our friend a little bit there. The more data you have, the more complete the picture is. It can jump around a bit, just off 1 or 2 days, but it's certainly above 1 now. Every infected person is infecting more than one other. The other point I'd make to you is that the exact question that you're asking is why I've got the modelers off doing this extra work, so that where are the case numbers going to get to with a whole lot of different assumptions, and will our health system be able to cope with that? We're doing everything we possibly can to make sure that we've got enough staff, enough beds, enough capacity, but what is certain is no matter how much capacity you have, if you open up too much too soon, that capacity will be under enormous pressure, and that becomes really, really challenging. It's not a matter of trying to frighten people. We're trying to avoid that. It's just a point of making the point. We'd all love to be open today. We'd all love to do the things that'll be safe at 70 and 80%. We'd love to do them today at 35% double dose, but all the doctors tell us, and common sense tells you, that you just can't.
Premier,
Now
you
that
need to say
COVID
that
zero
schools-
is no longer the aim, is it time to reconsider some of the border arrangements that have a lot of Victorians locked out? They are quite a few people stranded around the country.
Well, I think to Charnel's, I think the very first question, what we can't do is assume that now because zero is not the aim, we can just have as many cases as we have, and that'll all be fine. And 5,000, 10,000, whatever the number. Every case is very difficult for the person who gets it, for their loved ones. Every 10 cases represents another person in hospital. That's what the maths tells us. Not necessarily ICU, but hospital, and no one gets admitted to hospital because they're, mildly unwell. This is not a good thing to get. So we understand that getting those from Victoria who are locked out of their state, getting them home is an absolute priority, and we will have more to say quite soon, particularly as it relates potentially as it relates to that home-based quarantine pilot that I've agreed with the Prime Minister to run. I think that may well be the answer to get both returning Australians coming home through hotels and hopefully as many as we can people who are trapped in New South Wales back to their own state. I want to try and do that as fast as we possibly can, and a home-based model may well be, with technology, may be the best way for us to do that.
Premier, just on schools,
When do you think that could be possible?
Home quarantine. It's too early for us to say exactly, and I know why you ask, because it's kind of a de facto announcement for a whole lot of people that are trapped in New South Wales. I'll make the announcement when I'm ready to do that, and when we're all ready to do that. I don't want to be, just making up a date. It'll be as fast as it can possibly be, but it has to be safe, obviously. I know it's very deeply frustrating for people to be in another state wanting to come home. I don't want people locked in their houses, and I don't want people locked out of their state. But that's what this virus requires us to do at the moment. But I do think we can get significant numbers of Victorians who are particularly in New South Wales, home, and as soon as I can announce that, I absolutely will, with all the detail, and I'll be able to answer all the good questions I'm sure you'll ask me at that point.
Does home quarantine hinge on vaccination targets though?
May well, and it may well hinge on the vaccination status of the person who's coming to home quarantine.
does it risk turning Mickleham into a white elephant?
Sorry?
Does it risk turning the Mickleham facility into a
No,
white elephant?
because I think we will finish up, like as risky as, say, the epidemiological picture in New South Wales might be, there are going to be, for quite a long time, a lot of parts of the world where the risk profile is much, much higher.
Premier, just on schools.
And can I say, we've got hotels at the moment that are operating, and they operate as safely as they can, but they're not built for the purpose we're using them for. Mickleham will be.
Just on schools, will you allow public schools to have teachers who are not vaccinated working in them?
I don't know that we've necessarily definitively turned our mind to that. I'd be encouraging every educator, every person who works in schools to be vaccinated. The reason I say that is that obviously we have no vaccine for people under the age of 12. We have approval for 12 to 15-year-olds, but no bookings yet. So there will come a time around that term 4, and potentially sooner than that in regional Victoria, where school's back in the classroom and everybody is a risk to everybody else.
Will parents be told if their teacher is vaccinated, or would they be allowed to
Again,
ask?
that's part of what I'd said before. There is a lot of work going on around all these things. It's terribly frustrating, not just for you, but for me as well, to not necessarily be able to answer every single question at this point. That work's not finished. But we have made it clear that where we think there is a safety imperative, mandating vaccines is something we will do. It's not something done lightly, but it is something that we will consider and thoughtfully work through a process. And just like, if you're in aged care and you can get vaccinated and you have not got vaccinated, you're not on shift. That's in our aged care homes. And in private aged care homes, they're working towards, as part of a mandated single dose by 17 September. They're all working as a sector, home by home, to get that job done.
So just staying on schools though, do you have a sense, there's 50,000 public school teachers in Victoria, do you have a sense of what proportion of those are first and second dose vaccinated?
I know, but I can chase it up for you. I do know, and this is no chip on teachers and staff, but there are a lot of people who are currently eligible for a vaccine. They might not be eligible for Pfizer, but they're eligible for AstraZeneca, and I'd be encouraging any teacher, any educator, in fact I'd be encouraging everybody from every walk of life, every part of the state, every background, every profession, or no profession, go and make one of those 50,000 appointments and play your part.
And final thing on schooling, you mentioned outdoor schooling before. Can you say anything more about that?
Well, outdoor learning, we know that outdoor is safer than indoor. It doesn't mean it's completely and utterly risk-free, but the risks are lower. The CO2 monitor program is probably one of the most important things that we'll do, and that's hundreds and hundreds, perhaps thousands of those units being put into spaces. You measure how much airflow there is. Those that have poor airflow, you put a HEPA filter, a unit that filters the air into those rooms. We are well advanced in all of our planning and our work around that, but it's not ready yet. It does take some time, but there's some significant international evidence that shows that that really does reduce the risk, and we have to do that work, and we are. And I thought today was just a good opportunity to give a sense of the work that's going on. No definitive announcements. I know everyone would love that. I'd love to be able to fast forward all that as well. But when we're ready to make those sorts of announcements as part of that comprehensive roadmap, in what is a race to 80% double dose, we absolutely will.
Epidemiologists are commenting that we continue to see a pattern of spikes in case numbers 2 weeks after protests. What's being done to investigate that?
Well, I think Victoria Police have been doing quite a bit of investigative work.
But in terms of the cases?
Look, I'm not certain. We don't have an epidemiologist with us today. Maybe over the course of the weekend, one of the DCHOs or the Chief Health Officer himself might be able to speak to that. It's very difficult to know the impact of protests because people who don't believe this virus is real don't go and get tested for it. That's part of our challenge.
Premier, there was a report yesterday, I'm sorry I have to ask this, where we come from, Jenny McCarcos was critical of the CHO, particularly saying that that he needed to front up and the truth will come out, calling for an inquiry. What's your view of that?
I don't have a view on that.
Premier, the pilot program that you mentioned trialling in hopefully regional Victoria, are you able to say what industries may potentially be involved?
I think logically, so we're already having some discussions with the hotel industry, for instance. So the notion of getting all your systems up and running, so the link between a QR code and your vaccination status, at a pub in a beer garden, for instance, or at an the outdoor section of a restaurant, you'll see us make further announcements about some of those pilot programs, those trials, if you like. They'll be relatively small scale, but there's no good trying to move to a system that you haven't checked that the system works. So that's what we're going to go and do. That's possible, obviously, in a part of the state that's open. It'll also be possible in metropolitan Melbourne, very limited trial sense, once we get to 70% single dose, which is every time someone makes an appointment, we get a step closer to that. And it actually brings the date forward. Like, I think we'll beat the 23rd of September now because of the surge in vaccinations we've seen just in the last few days.
Just regarding the border changes, are people allowed to cross the border to visit intimate partners, that sort of thing? And
Permits,
also,
yeah.
if they aren't able to work any longer because of the changes that are coming into effect, is there support there for them? Because they work in one of the locations that no
sure.
longer
So
apply.
there's obviously Commonwealth Government disaster support for those who lose between 12 and 20 hours and those who lose more than 20 hours. So that framework kicks in, and there are payments that are made based on the number of hours lost. Both sides of the river are locked down. That can become slightly complicated and challenging if regional Victoria is out of lockdown, but they are locked out because of various border permit issues. Look, I think whenever you make these changes, there'll be lots of specific examples, and we'll work through those one by one. We don't want to see people worse off. We want to support people in what is a very difficult time. So it's probably more a case-by-case thing. If we can provide any further advice, then we'll do that tonight.
Can I ask your own view?
Absolutely, you can.
Sure.
Yesterday and today we didn't get numbers around how many cases were in quarantine. Are those numbers a thing of the past? We're not expecting to see them anymore?
No, look, I think our focus at the moment, look, we're undertaking, of course, all the interviews with the 208 cases we saw arrive in yesterday. Those conversations continue on till today. The number of those in isolation, now that number is starting to reduce as we're opening up new chains of transmission and new areas of operation. So that's not entirely surprising. We'll continue to track those numbers quite closely, and we'll give you an update over the weekend.
And on the cluster at that Box Hill
Yep.
construction site, 20 is quite a lot at one
Yep.
location. What's happened there, and can you give us any insights to exactly where in Box Hill that is?
Yeah, so I won't name the actual site, but there's a large construction site in Box Hill. It has around 85 staff associated with it, and there's also another related construction site by the same operator in another part of the city. So we've got around 85 or so primary close contacts that we're going through and testing. We have identified 20 positive cases already. Some of those are on site, some of those are in their household contacts. And again, it's an example of the risks and the challenges, I think, of running essential services, running essential businesses at this point in time. With community transmission in many parts of Melbourne, you need to be very careful with your workforce and make sure that you're putting those COVID-safe plans in place, because otherwise you'll see the risk of transmission just as we've seen at this site.
And were they operating at the right capacity? Did they have...
We're continuing our investigations with them. Look, it's a particularly large construction site. It's operating over multiple shifts. Clearly, the positive case, the index case for this has been active for a number of days. So it's not a brand new case. The quicker we can stop, if you're employing workers at this point in time, if you have to maintain your business as normal at this time, make sure your staff are getting tested, make sure your staff know what the symptoms are they should be looking for, and make sure your COVID-safe plans are working.
Were they
Julie?
abiding by COVID-safe plans?
Look, we're continuing we'll continue to work with the operator to make sure they were. At this point in time, I don't have any advice to say they weren't, but we obviously want to make sure that they were in every detail.
Much as that question with the infectious in community number, we're seeing in New South Wales that it's only very major exposure sites that are publicly listed. Contact tracing, obviously, given the scale of their cases, is significantly scaled back. Are we at a point there, or are we still chasing down every single case as per we were when it was 10?
Absolutely. So we are continuing to chase down every single positive case. So every positive case gets a phone call within hours of that result being in our labs. We reach out to them. We're there to provide initially and crucially that support. Are you okay? What other support do you need? And how do you make sure that you can isolate safely? And who are your primary close contacts? So that protocol, that work, that rhythm continues to be in place, and we're well on top of that. And all the national indicators that are published regularly, we're all over those. So there's no specific issue there. But what is important is that when we see people present so late, that we already have other members of the household that are positive, they've already infected a number of other people, that's where these numbers start to accelerate quite quickly, and that's of major concern. So the feedback we're getting again in recent days is that people have a range of concerns and reasons for not coming forward. They're not sure what's going to happen to them, they're not sure what the symptoms are, they're not sure how we will respond. We just want to make sure we can look after people and get them safe and get them isolated. That's the only thing we're trying to do. So if you're not sure, get tested and we'll look after you.
Gerard, I just have a couple of questions about Shepparton. Has there been any more downgrading of exposure sites there?
Not recently, Clay. So obviously with the focus for us now, the last couple of days has been that day 13 testing. What that will do is it'll really simplify the map essentially and the number of exposure sites. I'm expecting to see a significant reduction in the active primary close contacts, which will release a huge number of people back to their businesses, and that will, I'm sure, will be a relief to them. We will, I think, continue to have positive cases in Shep for a number of weeks yet, so we'll need to continue to manage that very closely.
Do you anticipate extinguishing the outbreak there?
Yeah, absolutely. I mean, we will. We've every time we've seen those defined clusters, we've managed to roll them up and extinguish them pretty effectively. We're getting great support from people in Shep who are isolating, and the people who are supporting them to isolate. So again, providing people play by the rules, do what's asked of them, and call for support when they need it, we can absolutely get these things under control.
Just on the Acquire call centre outbreak in St Kilda, are reports that the call centre was doing contact tracing work for the Victorian government. Are they correct? And if so, what kind of pressure does that add to the state's contact tracing unit?
Yeah, look, so the Acquire call centre operates across a number of different sites. It is one of a number of suppliers that we use for a range of outbound call facilities. So they are involved in some of our follow-up with primary close contacts. They receive some other calls from some of our lines. We have 4 or 5 different operators who provide that service to us, and this is one of the larger ones. So they have deployed and continue to deploy most of their staff from home, which is what they should be doing. We're continuing to run those services. We've maintained our call levels over the last few days. So I'm not expecting that to change. And some of our other operators are doing more work as Acquire has slightly fewer people available to them. We'll continue to monitor that situation very closely.
Do you know how many people have been taken out of the contact
Yeah, so look, we operate on a normal day or over recent weeks, we've been operating around 1,100 call operators across our various suppliers. Acquire has dropped its numbers. I don't have Acquire's numbers in my head. We've reduced the number of operators from Acquire, as they've obviously got some people who are isolating and not available to them, but we've upped the numbers with other operators, so we still continue to offer about 1,100 people across our various call sites.
And just, are you able to tell us the total active number of mystery cases you now have in the state?
We have around 1,180 active cases in total across the state at this point in time.
But mystery cases.
Oh, I can come back to that tomorrow.
Yeah.
Premier?
Sorry, there's another one for me.
Premier, we've had news overnight that Panit, who you may be familiar with from some years ago, has again been apprehended in India. Is that something that you were notified about?
I was informed of it just as I was coming to this press conference. Obviously, I've made many comments in the past about that individual and the cowardly way in which he avoided justice for his appalling conduct. So hopefully him coming back into custody back in India takes us a step closer to him serving time. I don't want to say any more than that because I wouldn't want to put at risk any processes that are not yet concluded. But he ran as cowards do, and the family of his victim needs to have that justice. We all do. Any other issues? I'm sorry to... Yes?
Sorry, just one question.
Sure.
Would you consider engaging the private healthcare sector to expand ICU capacity?
I think it's important, all of us, to acknowledge that last year and again right now, we have two health services, but we have one health system.
Right.
We all work together, and that's what got us through last year. And that's what will get us through the inevitable peak in cases and the inevitable peak in hospital demand. We will be working as one system. So whether it's a public health service or a private health service, they'll be working together as one health system. That's when we're at our strongest. That's what happened last year, and that's what will occur this year.
Premier, you spoke about the importance of people not thinking restrictions aren't as important anymore just because we're no longer aiming for COVID zero. There is footage circulating of a high-profile person appearing to breach COVID restrictions. Do you have a message for that person or people who are
I'm not sure which
tempted?
video you're referring to. Look, I would urge everybody to do their very best to follow the rules all the time. I know it's tough, I know it's difficult, masks and things. It's a pain. But think about it this way. Every 10 cases represents another patient in hospital that our nurses have to provide care for. We don't have an infinite number of nurses. We can limit the growth in these cases, and we need to. And the best way to do that is to follow the rules, as challenging as they are. Get tested as soon as you are unwell, and get online right now and take one of those 50,000 AstraZeneca appointments that are available, just waiting for your name to go alongside them. And if I need to open up more AstraZeneca appointments once they're all gone, I absolutely will. The best vaccine you can get is the one that's available today, and there's 50,000 appointments, hopefully a bit less than that since we've been talking about it this last hour or so. Beyond that, I don't tend to comment on footage I haven't seen. Any other issues? Sorry to run, but I do have a National Cabinet meeting to get to. Thank you all very much.